Good evening, ladies and gentlemen, and welcome to Chicago Blood Cancer Foundation's Battling and Beating Cancer program. This is our live interactive show where we will take your calls during the course of the evening. My name is Scott Seaman. I'm a Chicago corporate and business trial lawyer by day, but this show is not about the adversaries that I face in the courtroom. It's about the adversary that I faced about 12 years ago and didn't think I could beat, and that adversary is cancer. I'm a 12-year survivor of non-Hodgkin lymphoma, which is a form of blood cancer, and I'm one of the co-founders of the Chicago Blood Cancer Foundation. When you think about cancer, it'd be helpful to think of different forms. The first form being solid tumors like colon cancer, breast cancer, lung cancer. The other major type is basically your skin cancers such as basal cells, melanoma. And the third major group of cancer is blood cancer. And that's what we're talking about primarily on this show, which is lymphoma, leukemia, multiple myeloma. And within those categories, there's, for example, about 75 types of lymphoma, 5 or 6 forms of leukemia, as well as multiple myeloma, which is called multiple myeloma usually because by the time people get diagnosed with myeloma, it's usually in more than one location. So I realized that when it comes to TV, I have a face for radio. So I've surrounded myself tonight with 2 beautiful women who I'm going to introduce very shortly. But I think the point of the program is that cancer impacts so many people. Charlene, my co-host, often says that 1 out of 2 women in America, and 1 out of 3 women in America, and 1 out of 2 men in America will hear the words, "You have cancer," at some time during their life. And when you hear those words, it scares the heck out of you. But the good news is that people are fighting back. More and more people today are surviving than ever before, and we're fighting back using the main weapons that we have to combat cancer. Things like education, public awareness, and research, because really research, medical research, is the key to all of our long-term survival. And tremendous progress has been made in the past several years, and there are a lot of exciting things that doctors and researchers are working on now. So over the next 13 weeks on Battling and Beating Cancer here on CanTV 21, we will be exploring a wide variety of topics relating to blood cancer. We will have some of the best doctors in the business on the program starting tonight. And we'll have nurses, we'll have other folks on the front lines of the war against cancer. And while our focus is on blood cancer, a lot of what we say is going to apply to many other forms of cancer. So let me introduce my co-host, who's an extraordinary lady. She also happens to be my wife and my better half, the reason I was able to beat cancer, Charlene McMahon. And Charlene is CEO and co-founder of Chicago Blood Cancer Foundation. She's co-author of the book Battling and Beating Cancer, the Cancer Survival Book. And she's a Jefferson Award winner for her cancer research, fundraising, leadership, education, and public policy advocacy. And this is all a long way of saying Charlene has helped a lot of people who have battled cancer. She serves on the National Board of Selectors of the Jefferson Awards for Public Service, and the Jefferson Awards are the Nobel Prize for Public and Community Service. And Charlene is a lot easier on the eyes than I am, and I have to say, this is as long as she's ever let me talk without interrupting me. So without further ado, let me introduce Charlene McMahon.
Thank you, Scott. Well, that was very, very nice what he said. He doesn't say these things at home, but anyway, hello everyone. Since this is our first program, I wanted to tell you a little bit about the Chicago Blood Cancer Foundation. We are a 501(c) not-for-profit organization led by volunteers impacted by blood cancer. Our mission is to cure blood cancer and serve individuals and families impacted by blood cancer by supporting blood cancer research at leading medical research institutions right here in Chicago. By raising awareness and educating people, we want to conquer this disease. Over the coming weeks, you will learn why we believe that blood cancer research is the super highway to cancer, curing cancer. That's one of Scott's Scott and I always say it's the super highway to curing cancer, and that's one of our big things.
And that's
we use.
catchy, so I want to get the
Yes.
credit for that.
Yes,
but it's
super
very
highway
important.
to cancer.
But the short reason is that almost every major breakthrough in cancer has come from blood cancer research.
Yes, it has. And we are very fortunate to have world-class doctors and medical centers in Chicago, and we will introduce you to many of them on this program. Our show is about cancer, but it's also about life and helping others. We will cover a lot of topics and spend a lot of time talking about the physical aspects of blood cancer, the psychological, the well-being of cancer. But when you get a diagnosis of cancer, it impacts your mind, your soul, your body, your emotions, your spirit, your social life, the bills, challenges, opportunities, joys, and problems you have before it just doesn't go away. Cancer has a lot of challenges to your life and doctor appointments, to your schedule. We talk about the importance of the will, of having a will to live, and cancer warrior mentality. And that's why we always say it has to be a cancer warrior mentality, and it is a super highway to cancer, curing cancer. Medical and physical treatments are critically important, but you also have to draw upon your mind, spirit, friends, family, and religion to sustain you. Behavior medicine has an important role to play. Sometimes these issues don't get the attention they deserve. So we will start out our series discussing these issues. And I want to thank you for joining us tonight, and I hope that we can help you along with any of the questions. You can call in and ask us any questions.
And just a little bit of information, if you want to reach out to us, you can visit us at chicagobloodcancer.org or call us at 888-792-9992. And it's our pleasure to introduce to this program today Dr. Janine Gauthier. And Doctor, we're going to take that overhead out of the way and let everybody see the second beautiful woman that we have on the show tonight. And before we get started, let me just introduce you a little bit. I won't do you justice when I say this, but Dr. Gauthier is a director of Psychosocial, Oncology, and Clinical Services for the Cancer Integrative Medicine Program at Rush University Medical Center, and she's assistant professor in the Department of Behavioral Sciences at Rush. She's a fabulous doctor, and like so many of the doctors that we're going to have on this program and that we're all blessed to have in the Chicagoland area, she really cares about people and patients and goes the extra mile. So, Doctor, thank you so much for joining us on Battling and Beating Cancer.
Well, thank you so much for inviting me. I'm delighted to be here and honored that I could be part of this initial program.
I have to say, we're going to take your calls, so if you want to get in, call us, 312-738-1060. We'll take your calls on the air in just a few minutes. But let's start out talking about not the physical aspects of cancer, but let's talk about the emotional, the psychological, the spiritual effects that cancer has on patients.
Absolutely. I think that's a great way to start. One of the things that happens when anyone hears from their doctor that you have cancer, the reality is there's a host of thoughts and feelings that many times start at that moment. Just the uncertainty of what does that mean. Many times it's what does this mean for my life? What does it mean for my family? What will happen? Which then can increase someone's emotional distress at that time. And I always say, talk about it as like an emotional roller coaster where individuals can go from day to day feeling like okay or not okay, and they kind of are on this emotional roller coaster constantly when they're dealing with a cancer diagnosis and hearing that they have cancer. The road ahead of them many times has a lot of valleys and hills that they have to get over. So from a psychological perspective, I think one of the things that happens is there's the, anxiety that is, what will happen, what are the questions that come up, what's my treatment, what will happen, what's my prognosis. So anxiety is one of the first things that I think many people will experience. There are a host of other emotions that go along with that, from depression, sadness, grief, to name a few.
And so one of the things it seems to me that all doctors can do is offer their patients something magical called hope. because there's no cancer diagnosis or type of cancer that has a 100% death rate. There's always hope, and there's always something that doctors can do to help. And could you just share with us a little bit, what is integrative medicine and what does that entail?
Absolutely. Integrative medicine is, the way we see it, well, it used to be complementary and alternative. So complementary is something that you use in conjunction as an adjunct. Alternative is used instead. Integrative is, we want to look at the mind, the body, the spirit, not only the best of mainstream Western medicine, but also those other modalities such as acupuncture, massage therapy, relaxation, imagery, hypnosis, yoga, anything that we can do to support the individual through their treatment and to decrease any emotional distress, decrease any physical stress, and hopefully improve quality of life while they're going through their treatment.
And really, I think what you said is key. This is not a substitute for conventional treatments.
Absolutely.
And a lot of us, and I know when the notion of chemotherapy scared the heck out of me. Nobody likes surgery, chemotherapy, radiation, but a lot of times those are the tried and true methods for curing the disease or putting it in remission. But it's all the other things you can help, which also help, I think, the cure rates and also help the patient go through the experience and the symptoms and the side effects from the disease. Could you just explain to us what sort of experience you've had in terms of using these different techniques and how it helps the patient?
Absolutely. Certainly one of the things that happens when people are diagnosed with cancer is there's a sense of loss of control. So anything that we can do to help individuals to feel like they're taking an active role in their health care. And so many times that's the one thing that we have worked with individuals, for example, working with patients to teach them relaxation skills in the face of the anxiety of treatment. Many times people are very anxious about needles, so we can teach them strategies, relaxation strategies to help them in the moment when they're having to deal with those treatments, the medicines, the needles,